Hello, and thank you so much for listening in for USBC updates for the field. My name is Cheryl Lebedevitch, and I serve as Senior Advocacy and Communications Manager at the U.S. Breastfeeding Committee. We support a network of breastfeeding coalitions and member organizations and bring them together to do the important work of supporting human milk feeding as a public health imperative. And I am very honored to have the opportunity today to celebrate our collective impact, as well as to share the latest policy updates and actions. The U.S. Breastfeeding Committee's National Breastfeeding Conference and Convening was held January 9th through 11th of this year through an online platform, bringing together 433 people to learn, connect, and act together around this year's theme, Ready for Anything, Rising and Thriving Breastfeeding Communities in the Face of Uncertainty. USBC would like to extend a big thank you to the conference program committee, the board of directors, and all of the volunteers that made this event a success. The event included 18 sessions, nearly 50 presenters, and featured attendees from 49 states, as well as DC and Puerto Rico. It was truly wonderful to be in each other's presence. And of course, in August, we celebrated National Breastfeeding Month with the theme Every Step of the Way, which is meant to speak to the need for continuity of care in the lactation field. And while National Breastfeeding Month serves as a framework for August events, community organizers have developed weekly observances to provide an opportunity for the nation to zoom in on lactation and the policies, systems, and environmental changes that are needed. Week 1 was World Breastfeeding Week with the theme Protect Breastfeeding, a Shared Responsibility. Week 2 was Indigenous Milk Medicine Week, which was formerly Native Breastfeeding Week, with the theme Nourishing Our Futures. Week 3 was the first ever National Asian American, Native Hawaiian, and Pacific Islander Breastfeeding Week, with the theme Reclaiming Our Tradition. And week 4 was Black Breastfeeding Week, with the theme The Big Pause, Collective Rest for Collective Power. This action-packed month truly featured more activity than we could possibly name today, but a few highlights included the USBC's very first toolkit to support coalitions to submit requests to their governors to make proclamations supporting human milk feeding. We watched in awe as dozens of states and communities shared proclamations this year. We also worked with partners to develop ready-to-use visual and written content, amplified community events, and mobilized grassroots supporters to urge policymakers to prioritize infant feeding. It was a beautiful and inspiring whirlwind of activities, and all of us at USBC are truly grateful to the many individuals and organizations who make all of this happen. And finally, I am very happy to present for the very first time the 2020 USBC Annual Report. Here are just a few of our favorite pages as a sneak peek, but stay tuned. The launch of the full report will happen very soon. None of these accomplishments would be possible without our members, partners, and supporters, and we are so looking forward to celebrating you through this report. Next, I'm going to share about why we do the work we do and what is happening right now in infant feeding policy. So why public policy? 6 in 10 breastfeeding parents report that they stopped breastfeeding earlier than they intended. This is not because of any kind of personal failure, but rather is because the policies and systems that surround and shape our lives are not built in alignment with human physiology. USBC cannot reach every family directly, but working together on population level changes, we can make a difference for every family. We can literally change the equation for public health. At USBC, we're focused on the big picture upstream shifts that will support lactating families on a population level and address the long-standing disparities in access and outcomes, so that when our children are grown, the color of their skin, the location where they live, and the job that they have will not be a predictor of breastfeeding success. But policy, systems, and environmental change is not easy. It is slow, it's filled with stops and starts. Human beings and human society are complex. with a wide range of issues addressed through public policy, which means that there are literally thousands of competing priorities. And the policy change process is complex, which means that new policies face many, many decision points and decision makers before they become real. But we also know that coalitions have unrivaled strength and power to get these things done. We know that the best laws and policies are discovered and developed when stakeholders from across the nation and across sectors and across all levels of the system are at the table, so that as many perspectives as possible are included in the conversation, and so that we can reduce blind spots and unintended consequences. By joining forces, we can maintain our efforts until the job is done and make sure that at each point in the policymaking process, we have the right messenger bringing the right message at the right time. So thank you for being a part of this incredible coalition. Our role as a coalition really allows us to help connect the dots between the lived experience of families, the policies that influence that experience, and all of the systems and organizations and stakeholders that contribute to those policies. We work with everyone from community-based organizations and national organizations and moms and dads and senators to really bring the voices of these stakeholders, of young families and those who support them to the halls of Congress. And every single part of that effort is important. There is a lot happening in infant feeding policy right now. So we're going to talk through several policy areas today, but for a more expansive list of policy updates, be sure to subscribe to the Staying Abreast Weekly Wire newsletter at usbreastfeeding.org/sign-up. So first, federal appropriations for breastfeeding. Each year, funding is allocated to a variety of federally funded programs that include lactation support through the federal appropriations process. These appropriations have helped build and strengthen critical programs and initiatives to improve maternity care practices, increase access to peer and professional support, ensure continuity of infant feeding care, increase support for lactating employees, and address disparities in breastfeeding rates. With this graphic from the National Priorities Project, you can see how the federal budget comes to be. Each budget is developed for what's called a fiscal year, which begins on October 1st and runs through September 30th of the following year. And developing that budget begins with federal agencies submitting budget requests, and then the president submitting a budget plan, which reflects the vision, values, and priorities of the administration. And this really sets the stage for the budget negotiation process in Congress. Congress then develops its budget plan, called the budget resolution, to set a total amount for spending, which is then sent to the House and Senate appropriations committees, where it's divided among 12 subcommittees, each charged with developing an appropriations bill. Once these bills pass both chambers, they must be conferenced to work out any differences between the two versions before being sent to the president to be signed. In summary, there are a lot of steps that lead to our federal budget. Funding relevant to the lactation field is primarily included in the Labor, Health, and Human Services Appropriations Bill, including the CDC Hospitals Promoting Breastfeeding Program. The President's Budget and House Labor HHS Appropes Bill for fiscal year 2022 both include $9.5 million for this program, which is level funding from last year. However, we know that a much stronger investment is needed to overcome the many setbacks in maternity care practices and access to lactation support during the pandemic, as well as to help turn the tide on the rapidly rising rates of chronic disease. So we are continuing at USBC to push for an increased investment this year. Since we're quickly coming up on the September 30th deadline with many steps in the process left to go, we can expect that a continuing resolution will be passed to keep the government open while negotiations continue. Next is paid family and medical leave. Research shows that access to paid family and medical leave has a big impact on infant feeding outcomes, but only 1 in 5 workers in the United States have access to it. Paid family and medical leave has been a topic of discussion in recent congressional sessions, but this year has seen significant movement and increased attention. This month, the House Ways and Means Committee held a markup of the Build Back Better Act. The markup included consideration of a proposal to establish 12 weeks of paid family and medical leave benefits for all American workers, and it was advanced out of committee. The legislation now goes to the House Committee on Budget before heading to the full House of Representatives. The next policy area with action happening right now is the PUMP Act. The Providing Urgent Maternal Protections, or PUMP, for Nursing Mothers Act would expand coverage of the Break Time for Nursing Mothers law to nearly 9 million additional workers and strengthen enforcement so that remedies are available when a parent's rights have been violated. There is lots of momentum building in both the House and the Senate. The PUMP Act was introduced in both houses of Congress with Republican and Democratic co-leads. The bill has been advanced by both the House and Senate committees, so the next stop is to go to the House and Senate floor for a vote. Next is the Women's Preventive Services Initiative. So the Patient Protection and Affordable Care Act requires insurers to cover without cost sharing certain preventive services, and this includes breastfeeding support, supplies, and counseling. The details about how this is defined is decided primarily through the Women's Preventive Service Initiative, or WPSI. Every 5 years, a multidisciplinary steering committee is formed to develop recommendations about the required coverage. And this is then shared with the Health Resources and Service Administration for review and inclusion under the HRSA administration supported Women's Preventive Services Guidelines. Right now, there is a public comment opportunity to provide input and influence on these recommendations. The deadline has been extended to September 28th, and this is an incredibly important moment to impact health coverage as it relates to infant feeding. It's important to note here that responding to public comment opportunities is not lobbying. The federal government is seeking input from agencies, organizations, and individuals, and this does not count as lobbying. So if the need for change in any of these policy areas resonate with you, I urge you to take just a few minutes right now to raise your voice. Our policy change efforts will be successful only if there are constituents who are willing to speak out. Please take a moment to visit usbreastfeeding.org/advocacy to find easy action tools for contacting your members of Congress to urge them to support these policy priorities. Take a moment to share your perspective about all aspects of infant feeding, your own story or stories from your service to lactating families. Keep an eye on public comment opportunities like the Women's Preventive Services Initiative through the Weekly Wire and share your perspective. Help elevate these conversations by publishing blogs or pitching stories to news outlets or writing and submitting an op-ed. Helping create change can actually even be as easy as amplifying action opportunities on social media. And of course, donating to the USBC helps fund our efforts to advance this important work. The messages and stories you share are an important part of our advocacy and demonstrate the real impact that these policies would have and that constituents want and need this change. You truly don't have to be a lawyer or a legal expert to make a difference. So with that, I'll close by thanking for your attention and dedication to infant feeding policy. Together, we can create a landscape of breastfeeding support. Thank you.